Hey, we're going to hear from Daniel, who's turning his speakers off right now at Evoq. And congratulations to both companies and the founders. They represent the top candidates from a process that we make them all go through to share their slides and a lot of back and forth. It's pretty rigorous, and there's probably 10 to 15 companies that apply for each one that gets to stand up here and pitch every other Wednesday. So congrats for getting through that process, and thanks for going through it. Really appreciate it. For those new to our program, StartUpNV is Nevada's statewide nonprofit startup accelerator and incubator. We operate 7 free entrepreneurship programs supported by government grants and corporate sponsors. We get additional financial support in the form of donated equity from the successful accelerator companies that get investment from us. And we also get profit sharing and fee sharing from our affiliated investment funds and syndicate. Our fortnightly pitch day offers companies the opportunity to join our accelerator program with an investment from Fund NV, our investor syndicate, plus matching funds from Nevada's SSBCI program. Since 2021, we've directly invested a little over $14 million in 28 startups. If you do the math, that's where we get the pitch day for $500K. These startup investments have grown in value to just a little under $50 million. So it's a little over 3x return on the investment so far. And we've also returned about 30% of that $14 million in the form of cash or shares, public company shares, to our LPs, which VC geeks out there will know is DPI, distributed paid-in capital, which is the gold standard for venture investors. Now, that set of statistics makes us a top 1% fund. Now, albeit it's on $14 million and not $1.4 billion, but still pretty good for a new group under 5 years of investing. So we're just getting started, and we're pretty excited about all that stuff. Now for the legal disclaimer. Today's pitches are for investment from our legally compliant venture funds and syndicate, restricted to SEC accredited and Nevada certified investors. We welcome the community to attend for educational purposes, both here live in the room and online. But these pitches are not a general solicitation for investment. They're not a general solicitation for investment. Special thanks to our sponsors, the City of Las Vegas, Clark County, and GoEd. Some quick housekeeping. We are live on Zoom, on YouTube, and we are recording. Each company gets 2 recordings, the public pitch and a private pitch. Now, we already heard from Deborah that she does not want her pitch shared, so it won't be. The 2 pitches are one, unless you tell us like Deborah, it goes on our YouTube channel, and it's from the time you introduce yourself till we get to the Q&A. The only people that get to hear the Q&A are the people who are here live tonight, and our LPs, who generally will watch it later. Founders, expect to get some post-event contacts. So usually a few hundred people watch these things after we've had our event here tonight. And some of those contacts are awesome, and some of them are kind of weird. So be patient with the weird ones, and please respond professionally. The rules for the show tonight are 10 minutes to pitch. Then once you're done with that, another 15 minutes of Q&A. Questions go in the chat. Leaf is going to be asking our questions tonight, as Maggie and Kara are in DC. Those of you who are in this facility with us today, we are now the operators of it. Our landlord is still the City of Las Vegas. They own the facility, but we are operating it now. So we are getting a little bit more aggressive about getting folks to come in and use it as a co-working space and rent some of the lovely offices we have open. So for the folks who are here, you can see it. For the folks who are not here and are on Zoom, if you're in Las Vegas and you're looking for a co-working space or a place to hold an event here in our room or any one of our 4 or 5 conference rooms, please check us out at the International Innovation Center in downtown Las Vegas, 300 South 4th Street, right at the corner of 4th and Lewis. I'll mention a couple of other fundraising things from our venture funds. Both Fund NV and 1864 we want to close out both of those venture funds by the end of the first quarter of next year. So any investors out there who liked all of that stuff that I was talking about up at the top of our meeting here, where we've invested $14 million and it's now worth a little under $50 million. If you like that kind of a return and you want to join our team and invest some money with us, Please check us out. You can get to us by going through startupnv.org and saying I'm an investor and then booking some time with me. You can also get to us through both of our fund websites, 1864.fund and fundnv.com. Fundnv.com is a $2 million pre-seed fund that invests $100,000 each in 20 companies, just like the ones that we're talking to tonight. The way that works is people pitch here on pitch day. Our LPs and our investment committee takes a look at that. If we like the company and we think it's interesting, we'll invite the founder back in to answer a whole bunch of more questions than we're asking them tonight. Tonight's just a little bit of what the founders ultimately end up going through before FundNV will make an investment. And if the Q&A goes well, then we do a whole lot of due diligence, which usually takes another few weeks to get it done. And then once the due diligence is done, we've got all of the documents to sign and the funding to get done. Once we've funded our initial $100,000, we go out to our syndicate, we write a deal memo, we ask our LPs in the fund to say, hey, we're investing 100 grand. Do you guys want to join us and double down a little bit? Almost always they do, which is why we call it pitch day for 500K, even though the fund only puts in 100K. Generally, our LPs invest a whole bunch more money, and then we take that whole pot of money that we invest from the fund and our LPs add to the mix, and then that whole amount gets matched by the Governor's Office of Economic Development SSBCI program. So while our average investment since 2021 has been $500,000, if you look at our more recent investments, they're actually much closer to $1 million based on the SSBCI matching and everything else. All right, Daniel, are you back online again? All right, so come on up. We'll get you to start sharing your slides, and I'll just pass him my microphone. All right, hang on, you're not on mic yet. You will be soon, as you put, and just stick that on the lapel, and you should be good to go. Take it away, whenever you're ready.
Thank you very much, Jeff. A little bit of technical difficulty, but I think we got through that. Let me get my slides all happy here. Slideshow. Okay, I think we have technically achieved to get up here. Good afternoon, good evening. I'm Daniel Lindgren. I'm the co-founder and chief executive officer of Evoq Technologies. Evoq Technologies is a company that's been around for 4 years. It's from our spin out of OcuScience, which was around for 20 years before that. So we've built some very robust technologies. And today I'm going to talk about one specific area of our particular technology, and that's looking at the ability for our systems to detect early diseases of the eye, have ways of acting early so we can actually be preventative, and protect vision for a lifetime. Now, how are we going to do that? Well, let's first talk a little bit about what's the problem we're addressing here. Right now in ophthalmology, standard imaging misses the earliest signs of retinal diseases. And that is because they have to wait for damage to occur before they can actually see something in the image. And vision loss is a very huge problem here in the United States and worldwide. Irreversible tissue damage occurs before retinal imaging can detect the disease. We're letting damage occur, and letting this damage occur before we intervene is later intervention. And that later intervention right now, the way our current system is set up, costs us $134 billion a year in the United States alone. And functional testing exposes these early signs of disease and enables proactive diagnosis and care. We have the ability to see these diseases in the retina before damage, years before, 3 to 5 years. It creates a golden window of opportunity for us to intervene with either lifestyle changes, therapeutics, and other types of monitoring that help guide the patient through what they can do to actually preserve their vision for a lifetime. There's also another really compounding problem we've got going on here in the United States and worldwide. The eye care specialist is in very, very short supply. In fact, the number of ophthalmologists here in the United States is actually going down over the next few years because people retire. And the number of schools that are bringing through the schools has been relatively flat. And what's going on at the same time? We got a big problem with age-related macular degeneration and diabetes, which is putting an even heavier load on the system than it is now. And what we need to do is need to figure out how we can get the patient and get to diagnostic tools at scale beyond just a specialist. How can they get help before they actually have such an amount of vision loss that then they need to see a specialist? We want to catch it earlier. We want to catch it earlier by deploying our technology further out and then before when it comes to functional testing of the eye. And we want to put these things into the optometrist office. You go there primarily for optometrists for your annual eyeglass change and checkup, but there's also an opportunity to conduct certain types of screening tests to really monitor you at a certain period of time to make sure that there's no underlying pathology. And functional home monitoring. This is the real front that we want to go to. We want to put devices in the hands of the patients in their home so they can conveniently monitor themselves. Much like CardioMobile does for the heart, we plan to do the same for the eye. The solution, our ecosystem of early detection diagnostics tools. We don't have just one, but we have several products that actually fit on the same platform. They all interoperate. They all provide this data at an aggregated level and allows us to do things that collect data in a very simple manner using a biosensor that sticks to the skin, passes that data onto the mobile device. The mobile device will then pass it onto the cloud does the analysis, and then sends the results to the provider, as well as access to the patient. This aggregated data now creates a real opportunity for us to use AI-powered functional analytics. We're creating the first functional data set for ophthalmology that's going to be global. Our portfolio pipeline for detection, diagnostics, and monitoring for a lifetime, they run across several different products. And first, I'm going to talk about Twilight, the dark adaptometer. As a Class 1 medical device, as you can see there, I have Q4 2025. We're imminent for our Class 1 registration and device listing. And I was hopefully going to be able to tell you that we got it done today. Next few days, the government's still opening up, things are a little slow, but it's imminent for us to happen. And then we're going to follow up with another product called the Smart ERG. So let me tell you a little bit about those technologies. The dark adaptometry test measures your ability for night vision. How well do you see at night? This is when the retina is working its hardest. And this is the time that we test it. And we want to see how well your age is able to go from a lit condition to a dim condition and be able to adjust accordingly. Then we have the Smart ERG, which is that after you say, oh, I have retinal dysfunction, the Smart ERG is now even a deeper dive diagnostic where the optometrist and ophthalmologist, the eye care provider can then differentiate what is the cause of that retinal dysfunction. And then we follow up with the Gleam. Gleam is a full field stimulating test, and that's really designed for people with severe impaired vision now. They need to have a tool that allows them to monitor the residual vision they have. And we have the ability to do that for them. So we give them the ability to see if the therapeutics are having any positive effect, as well as we are creating an endpoint, a therapeutic endpoint for the different new therapeutics that are coming along that are meant to help these patients who have night vision loss, diabetic retinopathy, age-related macular degeneration, and other inherited retinal diseases. And then lastly, we have this thing, it's called a dark adaptation pod. We actually started that. It sounds like a very basic thing, but we built a black box. It's a portal box. You can put it in the corner of your office and it creates a perfect dark adaptation environment. So we are really doing some of the most basic things to facilitate this really basic type of testing that's really robust and really powerful. Okay, how it works. Step one, when you connect to the body, and then we then have that connected to the console, we run the test. This is where we're using our biosensor to capture proprietary functional data. That data gets automatically uploaded to the SightGuard platform, either through Wi-Fi or even wirelessly through our devices. You can detect, and from there, SightGuard can detect the subtle changes in the retina health and follow up with additional diagnostics to really differentiate the diagnosis. And then through SightGuard, we share that data to the provider and to the patient. The patient has access to their data. They can longitudinally monitor themselves, and nobody's going to pay more closer attention to that data than the patient who has visual impairment. Market opportunity, it's huge. 7 million people are visually impaired and definitely have a definitive need for some product like we have for Gleam. 35 million are those who have retinal diseases that have already progressed and need to be monitored and have a clearer diagnosis and intervention. And then there's 57 million people who have retinal dysfunction and don't even know about it. And the reason we know that there's that many people is because we're projected to have literally a doubling of the people with retinal diseases and blindness over in 2050. So this is the pool we can focus on and do something about before 2050 rolls around and we've doubled that number. We can do something about this. Okay, our business model and return on investment. We have basically three parts in our pricing. We have the hardware, disposables, and our DAS, our diagnostics as a service. And basically, the hardware has a console, a photostimulator, and you can purchase that on a one-time purchase basis or as a lease. And then, of course, there's a disposable. For each time they do an examination, there's a cost for the kit that goes with that. And then flexible plans each month for different size tiers and practices. And you can see I have an example at the bottom here where this is the most basic type of sale for us. This is a single doctor practice. And we have that doctors who are going to buy this at a lease because, want to keep their capital expenditures as low as possible because they have a new practice, for example. $4,979 plus if they did 2 exams a day, 20 times for 20 days a month for 12 months a year, that's 480 exams. That's almost nothing. But that's about a $4,800 cost in disposables. And then overall the time, for those 12 months for our subscriptions, another $1,548. Well, what's it all mean? That means that Evoq Technologies is going to make $11,327 each year from that single doctor practice. And if you look at what that does for the doctor's practice, it's even more phenomenal. Because it only costs them $11,000, but they're able to actually bill this through different CPT codes ranging from $58 to our other devices could be $130 for those 480 exams. You can see there's amazing return on investment. It's my time.
Back to me. Since I spent a little bit of time talking about the funds, I'm not going to talk about them again, except to say if you're interested in them, we'd sure like to hear from you. Both FundNV is finishing its raise in Q1 and 1864 is finishing its raise in Q1. So look forward to hearing from some of you who like to invest in these wonderful startups that pitch to us every couple of weeks. So the way you find out more about it is you can go to either one of the fund websites, fundnv.com, 1864.fund, or to startupnv.org, and you can get to us that way. Thanks to thanks to Deborah, Mark, and Daniel for the presentations this evening. And really appreciate your going through the process to get here. Thanks also to our team, and thanks to all the folks at StartUpNV that make these pitch days possible every 2 weeks. And thanks also to our investors who are going to be, if they aren't here online tonight, that they'll be watching this later. Would appreciate it if everybody would give us a follow on LinkedIn, YouTube, Facebook, X, and Instagram. We're most active on LinkedIn and YouTube, but we do go on all those other sites as well. Thanks again to the founders and to the attendees for coming out tonight. Thanks for putting all the questions in the chat so that Leaf could ask them. Thanks to our investor group. And I hope you'll be back here in 2 weeks, just after Thanksgiving, for the next pitch day where 2 additional Nevada startups will pitch. Until then, take care of yourself, and if you can, someone else too. We'll see you back here in a fortnight, which is 2 weeks. See ya. Bye.